Good afternoon, ladies and gentlemen. We bring you greetings from Richmond Media Health Issues to your doorsteps. It's indeed another blessed day that the good Lord has given unto us for us to bring health issues to your doorsteps. Today is a blessed day and a brightest day for a healthy discussion. What we realize is that God has promised us one thing, and the promise is that whenever people think of getting married, there's a gift in place, and that gift is the fruit of the womb. That's the baby. But I realized that when some individuals had this gift, which is pregnancy, some again have some complications, which is anemia. And today with me, we want to dive deeper on how to handle pregnancy related cases like anemia in pregnancy. So to begin with, we will introduce our guest, and our guest is no other person than our sister Eugenia Baffoe. So, Sister Eugenia, you are welcome to Richmond Media Health Issues.
Thank you.
I believe by God's grace you are doing well.
Yeah, I'm well. Yourself?
Yeah, by His grace. So, viewers and listeners across the world, today is another day, and we bring you more greetings. We pray that the good Lord continues to be with us, sustain us throughout this year, and as we are about to end 2024, may we continue to have good strength to enter the 2025. Sister Eugenia, your viewers and listeners across the world, we are ready for you. What is special about today's presentation, you being in the field as a midwife, anemia in pregnancy? What should we expect in today's presentation? Thank you.
Well, for today's presentation, we are to expect the definition. We are to know the definition, the types of anemia, what the signs and symptoms are, how to diagnose, treatment and prevention, then finally, complications of anemia in pregnancy. So that's what we will be looking at for today.
Okay, thank you. So, although we are in some part festive seasons, how people are celebrating, but as you are celebrating, we want to tell you that if you are thinking of becoming pregnant, or if you are pregnant and you are not careful, there's a condition in pregnancy that we call anemia in pregnancy, and that's why we are still celebrating this with you. So please, can you help our viewers and our listeners to be able to understand what at all is anemia, then being attached to pregnant women? Thank you.
Okay, so when we talk of anemia, anemia is strictly defined as decrease in the red blood cells, which we normally call the RBC mass. And mostly the function of the RBC is to deliver oxygen from the lungs to the tissues, and carbon dioxide too is being carried, accomplished by using the hemoglobin. Yeah. Then anemia in pregnancy. For anemia in pregnancy, in every normal pregnancy, blood volume increases, and when the blood volume increases, it results in hemodilution. And even though the red blood cells mass increase with pregnancy, plasma volume also increase. And when this happens, it results in anemia. So anemia is basically lowered hemoglobin level and RBC. So anemia, for us to get to know it, mostly the value is less than the 5th percentile of the HB level. And in the first trimester, we have an HB that is to be 10.5 or less. Then 11.0 in the third trimester.
Okay, so you are helping us to understand that the moment you become pregnant, then it means that you are to expect that if you don't live a healthy lifestyle, if you don't pay attention to the pregnancy, there's a likelihood that your negligence or your ignorance in an aspect can let you have a condition that we call anemia. And because you are pregnant, that is why we said anemia in pregnancy. I hope that is clear.
Yeah.
We thank you for that clarification. So we want to ask you, do we have some criteria or some types in of anemia in pregnancy? Do we have some types, or we classify everything, every HB that will be lowered as anemia? If you can take us through the criteria and types of anemia in pregnancy. Thank you.
Okay. So for the criteria, we have mild anemia. And when you talk of mild anemia, the HB ranges from 10.0 to 10.9 grams per deciliter. Then we have type 2, we have the moderate anemia. That one, the HB ranges from 7.9 grams per deciliter to 9.9 per deciliter. Then we have the severe anemia. For that one, the HB is less than 7.0 grams per deciliter. So overall, we have 400 types of anemia. And for the purpose of this study, we will limit it to 3 types, which mainly affects women in pregnancy. So we will be talking about iron deficiency anemia. We'll be talking about vitamin B and folate anemia, then black diamond. So for the iron deficiency anemia, it affects 75 to 95% of anemia in pregnant women. So a pregnant woman who is having insufficient stores of iron to meet the growing demands of the fetus, this pregnant women normally need 60 milligrams of elemental iron on daily basis throughout pregnancy. So this is a picture of the red blood cells and the fetus in utero. And the type 2, we also have the types. For number 2, we have the diamond black fan anemia. For this one, it's a rare autosomal dominant disorder of the pure red blood cell aplasia in stating life. So for this type of anemia, the person needs a long time transfusion. So women who are contemplating to get pregnant, they need to get consultation or see a hematologist before they can get pregnant. So this is a baby that the mother suffered the black fan diamond anemia. So this some of the features, what the babies go through when the mothers have that type of anemia in pregnancy. Yeah, there's another picture. Okay, so the next type, you talk about the folates and the vitamin B12 deficiency. So these are the essential nutrients for a healthy pregnancy. So when one a pregnant woman is deficient of the folate and the B12, there are significant consequences that affect the mother and the developing fetus. So for the folate, which is also known as the vitamin B9, for this particular vitamin, it prevents the birth defect of the brain of the fetus and the spine. It also supports the growth and development of the fetus, and also help produce more red blood cells. So the neural tube defect example is the spinal bifida. Then the vitamin B12. For this one, it's essential for the production of red blood cells, and it's also necessary for maintaining the nervous system, and it is also involved in the synthesis of the DNA.
Okay, thank you. So this tells us that at times there will be a child, and when you look at the child, what people who are not into the health setting will classify it as, oh, then this one, it means that it is for the gods. So let's go and just kill that individual. So this lesson is trying to tell us that a type of anemia in pregnancy can even affect the development of the child to have a defect. I hope that is what our viewers should put in mind.
Yeah.
Okay, thank you. So looking at this, what are some of the signs that will suggest or tell us that an individual is developing anemia in pregnancy? But before that, we know that nothing occurs without a cause. So can you please take us through the causes of anemia in pregnancy? What can cause anemia in pregnancy? Thank you.
Okay. So for the causes, we have certain types of infections that can make one get anemia in pregnancy. So for examples, we have the cytomegalovirus, we have the HIV, we have the hepatitis virus, we also have the Epstein-Barr virus, we have malaria, we have hookworm infestation, and Clostridium toxin. So if the patient have history that suggests to any of this infection, it is appropriate that test should be performed. Then next one, we have starvation and generalized malnutrition. Starvation and generalized malnutrition. We also have multiple pregnancies. Then we have trauma. We also have burns. We have nutritional deficiency. That's example of the type we got, the iron deficiency and the vitamin B deficiency together with the folate. Then we also have G6PD. We have drugs. Yes, some drugs. So some anti-malarial drugs, especially the ones that contain the quinine compounds. We also have sulfonamides. Then we have penicillin. We have chemicals. So some of the chemicals we can get the chemotherapeutic agents. You also have benzene, then exposure to radiations. These are some of the causes that can make a pregnant woman get anemia in pregnancy.
Someone just typed in that multiple pregnancies. That how is the multiple pregnancy? Is it that the person has been giving birth or has been having pregnant for more, or what the person is carrying is multiple? Can you explain that to the individual? Thank you.
Okay, so when you say multiple pregnancy, basically more than one fetus in utero. We can have twins, we can have triplets, we can have quadruple, like 2, 3, 4, 5, 6 onward. So that's the multiple pregnancies.
Okay, thank you. So I think the person was thinking if the person has given birth or have pregnancy for several months, then he falls victim. Okay, so please what are some of the signs and symptoms that can suggest that an individual is developing anemia in pregnancy? Thank you.
Okay. Yeah. So for the signs and symptoms, we have fatigue. We also have shortness of breath, coldness, dizziness. We have headaches, pale, dry, or easily bruised skin. There is general weakness. Then at times there is numbness and tingling of the hands and feet. We have sour tongue, then fast heartbeat, then reduced fetal movement. So these are some of the signs and symptoms a pregnant woman should consider when we are to diagnose anemia in pregnancy. These are some of the signs and symptoms.
Okay, thank you. So this means that the men, the husband should also take note. So it doesn't necessarily mean that the lesson is anemia in pregnancy, so it's for the woman and for the pregnant woman. But it's good for you, a viewer and a listener who has the intention of getting pregnant to impregnate someone, to have this idea, so that when your pregnant wife is passing through some changes, you'll be able to identify. On this note, before we continue, we want to um, tell our viewers and our listeners that if today is your first time of watching Richmond Media Health Issues, we want you to just subscribe so that whenever we are having educative program like this, you'll be among the first people to get the notification. Then also you can just share for someone to also know that there's a condition in pregnancy that we call anemia, because people think that the moment they are pregnant or someone is pregnant, that's all. They are just waiting for the ninth month to deliver, but not knowing in that 9 month journey, there is something that we call anemia that can occur in pregnancy. Okay, thank you. How can someone be able to know that he's having anemia? Diagnostic investigations that can be done to confirm that individual is having anemia in pregnancy, aside the signs that will be presented. Thank you.
Okay. So for the diagnosis, we can talk of the medical history. So when you talk of the medical history, you are to assess this pregnant woman for risk factors. Mostly when this pregnant woman has suffered anemia before in pregnancy, when this pregnant woman is a sickle cell or have had multiple pregnancies or has a chronic disease. So we also come to the physical examination. Then we are looking at the signs and symptoms we earlier talked about of anemia. Then obstetric history. So the pregnant woman, we should have a good review of pregnancy complication. That is bleeding, any form of bleeding in pregnancy, or placental abnormalities. Then for the laboratory test, we have the full blood count. The full blood count will help us to detect the hemoglobin levels, then the proportion of the red blood cells that we call the HCT. Normally the red blood cell ranges from 33 to 40%. We also have to get to know the size, the average size of the red blood cell, and the average size, the ranges from 80 to 100. Then you also have to get to know the average amount of hemoglobin in each red blood cell. So for that one, we term it as the MCH, and the MCH, the normal range is from 27 to 31. Then we also have to do iron studies, and for the iron studies, we have to measure the serum iron, the transferrin saturation, and the ferritin saturation. We also have to do reticulocyte count. That one measures the number of immature red blood cells. So these are some of the diagnostic tests to help us diagnose anemia.
How can one be able to know this? Can the person just walk to any facility, or your advice on how to be able to properly monitor your blood level in addition to the other labs? What's your advice to the pregnant women? Thank you.
Okay, so for every pregnant woman, it's advisable that you visit the antenatal clinics, because during the antenatal clinic visits that we will get to know all information pertaining to you and pregnancy, that when we can run a lot of tests, know you can take scans, then other things to know the placenta, like any abnormalities. So without the pregnant woman visiting the ANC, it will be very difficult for one to say that I have anemia based on the signs and symptoms, even though the signs and symptoms, though we've talked about it, is similar to other conditions too in pregnancy. So one has to visit the antenatal clinic. You shouldn't have the mindset that when I'm going, I have to pay a whole lot of money, but that should not be it. Just be concerned about yourself and the fetus in utero. That's the main thing.
Okay, thank you. So it doesn't mean that because you are experiencing the symptoms that we've mentioned, just pass through any pharmaceutical company or a pharmacy shop and procure blood tonic, because you've known that some of these are some signs that suggest that you are anemic, but we need to know the type. Thank you. Upon this, how can you help our viewers and our listeners on how to treat and prevent anemia in pregnancy? Thank you.
Treatment and prevention. Okay, we will talk about that, but there is another diagnosis test that can also be done. Then you have the bone marrow biopsy. Bone marrow biopsy. This one, it may be performed in cases when there is severe anemia or suspected bone marrow disorders. Yes. So there's another diagnostic test that can be performed aside the ones we talked about. So with the treatment and prevention, first and foremost, any woman who wishes to get pregnant, there is a need for preconception care. This will ensure that there is adequate iron stores in the body before pregnancy, because if the iron stores in the body is not enough, it should be corrected before pregnancy. Then prenatal vitamins too. One is to take prenatal vitamins that contain iron, folic acid, vitamin B12 and stuff. Then dietary changes. Remember, in the signs and symptoms, we talked about starvation and malnutrition. Yes. So if you are the type that tend to starve yourself a lot, or you yourself, you are suffering from severe malnutrition, it should be changed, because you need to consume a lot of iron-rich foods. You have to consume a lot of vitamin C-rich foods, folate. An example, we have the green leafy vegetables, we have the beetroot, we have the spinach, etc. And we can also talk about the meat. Then adequate intake of water. And we also have one has to do a lot of the blood test. So you have to monitor the HB levels throughout pregnancy. Then health education. All women should know the importance of anemia prevention and treatment. Then also, if you have in mind of getting pregnant, you should avoid inhalation of gaseous substances, because in one of the courses we made mention of certain chemicals. Yes, so one should avoid inhaling certain gaseous substances. It's not all substances that somebody who is aspiring to get pregnant should get it into their body system.
You can continue with the treatment for us. I think our network, yeah, so I think she's back. So please continue with the treatment for us.
Okay, so the treatment, yeah, who have multiple pregnancies and anemia. So when one is special care, very, very special, even though all pregnancies are special, multiple pregnancy is also a form of abnormal pregnancy. So this woman needs special care. That's why when one is pregnant and it's a multiple pregnancy, one shouldn't take it for granted. Then when a woman is suffering from chronic diseases such as the kidney and the rheumatoid arthritis, all this group of person should see their specialist before they get pregnant. And even when they get pregnant, they still need to get their specialist attention throughout the pregnancy. Then for the vegans, women who follow the vegetarian diet, they need additional supplements and dietary guidance to help them with the pregnancy throughout. Yes, so they also need a special diet aside the normal diet they have. And in treating anemia in pregnancy, it is essential that iron supplementation is not taken out. Iron supplementation is not taken out. Folic acid and vitamin B should not be taken out. So one really have to eat well. Then in cases when there is severe anemia or bone marrow issues or with the black diamond, the other type that we talked about, this pregnant woman might need blood transfusion. Remember, with the severe anemia, we talk about HB7, HB of 7. So great volumes of hemoglobin levels, it affects the fetal development. It also affects the mother. So when it becomes severe, the medication, the diet, and the lifestyle changes alone is not enough. The pregnant woman needs to be transfused with blood. Sometimes one pint, 2 or 3. It depends on how severe the anemia is. Then,
Okay, so looking at this, if an individual is worrying or he ignores all the signs and symptoms and the necessary checks, what are some of the complications that can occur on the side of the mother and the side of the unborn child and the society as well? If you can take us through the complications. Thank you.
okay. So for the complications, the pregnant women can have complications with anemia. Then the fetus too can have complications. Yes. So for the mother can have a preterm delivery. The moment you say preterm, it means the pregnancy did not get to the full term. It can be somewhere within the second trimester or the third trimester, but the first to 3 trimester was not completed successfully. Was not. Then the mother can also have arrhythmia. Then in severe cases too, the pregnant woman can have an enlarged heart We can also have heart failure in there for the woman. You can also have organ damage on the parts of the mother carrying the fetus. Then we can talk of postpartum hemorrhage. This one, the moment the mother delivers, whether via cesarean section or via vaginal delivery, this woman who has suffered anemia, which is not managed or treated, will bleed. Then we also have postpartum depression, and we can also have death. It would be sad that something that can be managed or treated was not managed and treated as such. Then in the long run, the pregnant woman, upon all the stress of pregnancy, will lose her life. Then the fetus too, the complication on the fetus side, we have prematurity. So far as there is preterm delivery, there is prematurity because the fetus in utero is not matured enough to come out. Then we have the low birth weight. Low birth weight normally weight less than 2.5 kg for baby, because the normal weight range for a normal baby is 2.5. So when you say low birth weight, it is normally below the 2.5 kg. Then this baby, when it's out, it's baby, but when it's in utero, it's fetus. So in utero, this fetus can have anemia at birth when it's out. Then with the brain development too, this fetus is likely to have poor mental and psychomotor performance. Then we can also have the neural birth defects with the spinal bifida. Then we have stillbirth. Then we have IUFD. All these two, stillbirth and IUFD, is all death. But the IUFD, that's intrauterine fetal death. The fetus dies in utero, inside the womb, before this fetus come out. But the stillbirth, that's can come with the delivery. The fetal heart rate will be there all right and everything, but with the birthing process, the fetus can die. So that's what we term as the stillbirth.
Okay, then it means this condition that we are seeing is it can be very serious and at a point life-threatening, but there is hope. And the hope
Yes.
is that early detection, knowing, is one way of treating. And the other thing is the lifestyle changes, you visiting a proper professionals to be able to ascertain these aspects. So never be worried. As a viewer or listener, probably you might be diagnosed of anemia in pregnancy. And as we are talking about the complications, you are thinking, am I going to have stillbirth, IUFD, or postpartum hemorrhage and things? No, never be worried. Just have positive mind. Follow what we are going through, and there is a future plan for us that you will deliver safely. So, on this note, Sister Eugenia, what is your take-home message for our viewers and our listeners? Thank you.
Well, the first preventive step is always the iron supplementation. Whether you are taking the drugs, the iron supplementation, or the food, but just know that the iron should be supplemented all round. Then also dietary changes. If you are the type that have issue with the type of food you eat the moment you are pregnant, bear in mind you are not eating for yourself alone. You are eating for yourself and the fetus in utero. So you have to try your best to eat. And when I say eat, not just any food, adequate food that contains all the nutrients. And also for the caregivers and all those that support pregnant women in pregnancy, I will advise that keep on supporting and encouraging the pregnant women, because there are a lot of disorders in pregnancy, and one of the disorders in pregnancy that makes the pregnant woman find it difficult to eat is when there is hyperemesis gravidarum. Anything that goes into this woman's throat have to come out. So how will this person get the nutrition that she needs to support the pregnancy? So such a person have to eat in bits, yes, and at regular intervals. So the pregnant women need encouragement and support because they are not alone in this pregnancy journey. So supporters and caregivers should do well, encourage them to eat, and there should be varieties. They shouldn't be eating one food all the time, so that all the time their appetite can be piqued to be eating all food that they have to eat. And also the blood test. It's very necessary, very, very necessary, so that if the blood level is going low, we know the management to take. Are we using drug? Are we using blood transfusion? So if you're not the type that visit the antenatal clinics, it would be very, very difficult for anemia to be diagnosed and also managed at the same time.
Thank you. Thank you very much for this in-depth knowledge shared with our viewers at this very early day of the month and the year that we are in, 2025. You realize that you've done well, and some questions are there from our viewers to you. And one question that has been posted is that, is it a guarantee that all pregnant women will be anemic?
No.
That's someone's question. Please,
Okay.
is it a guarantee that the moment you get pregnant is equal to anemia? That's someone's question.
No.
Okay.
When one is pregnant,
Mhm.
when one is pregnant, it's not a guarantee that this person is likely to get anemia. If this person takes the antenatal care visit very serious and goes on time, have adequate nutrition, and is also having the iron supplementation, the folate and folic acid supplementation, and adequate intake of water, it's very rare for this person to have anemia unless this person has other condition. Yes. When this person has other condition, that will affect the red blood cell levels. This person will still get anemia. But aside that, if all that we've talked about, this person is taking it into consideration and heeding to it, it's very rare for this person to get anemia in pregnancy.
Okay, I know this viewer might be someone who is now becoming scared and was thinking that if all pregnancies will be equal to anemia, then she will not get pregnant. Okay, another question that a viewer sent is that how can one know the type of anemia he's suffering from? Because you mentioned about the types. Is there anything that will clearly shows, or unless the person visits the ANC, then there should be a diagnostic test for the person? So if you can help that individual, how can he know that my type of anemia is A, B, or C? Thank you.
Okay, like we discussed earlier with the study, the how to diagnose it. Aside the physical examination, aside the obstetric history, the best way for one to identify this is go to the hospital or the antenatal clinics, because when the blood is not drawn from the person's vein, we can't just look at your face like being a form of magicians to say that you are having this type of anemia unless a test is being done. And the test is normally blood test so that we know the HB level and the type of anemia we are looking at, because all the findings will show in the test results. So that will help diagnose the particular type of anemia we have and how to manage it.
Okay, thank you. There's someone said you mentioned about arrhythmia as part of the complications. If you can um, explain the arrhythmia to that individual. Thank you.
Sorry. For the arrhythmias, that's the fast heartbeat, or let me say palpitation. The heart beat faster than normal when there is anemia in pregnancy.
Okay, thank you. Indeed, our viewers and listeners have enjoyed the lesson and wondering why this first week in the new year we have started to discuss this, which means that Richmond Media wants people to get pregnant. And as you are getting pregnant, also think that you need to take good care of yourself so that you not be anemic. Also,
Yeah.
to our husbands and our men, note that you also have a major role to play. Or, Sister Eugenia, am I lying or I'm sitting?
And you're not lying. For
Yeah.
pregnancy, it's not only for the woman, it's for the two of them. That's the partner. Both of them are in the pregnancy together. So they need the support they can get from their partners, so far as pregnancy is concerned.
So, beloved, if you've heard nothing at all, as part of the preventive measures, he said one of the ways is education. And Richmond Media, I think, per this criteria that our midwife has given us, we have passed because we are educating the public about anemia in pregnancy. There's one part of you knowing, and there is the next part of you taking action. But since you have gotten the knowledge from our sister, it's up to you that your body belongs to you. If you take good care of it today, tomorrow it will take good care of you. So on this note, we want to say God bless you, Sister Eugenia, for your time and everything that you have shared with us, a precious knowledge. Our viewers and our listeners, we want to thank you very much for your time, your bundle, everything for watching us. So same time next week, we will bring health issues to your doorsteps. But until then, bye bye for now.